in Hong Kong and found that wearing protective eyewear negatively correlated with eye injury in the workplace, which means that if we use the prophylactic measures and if we use the protective devices, we will definitely be able to lower the incidence of ocular trauma-related blindness. And the study from Andhra Pradesh eye disease study found that the rate of trauma in a city like Hyderabad was 3.97%, and with 1 in 167 people, the population considered to be blind at least one eye secondary to the trauma. A review of trauma in a hospital in Taiwan found that 83.1% of the eye trauma population was male and 48.1% related to work trauma. Maybe this gender, division may be same in other countries also. India also, we have more, trauma with the males than the females. And the visual prognosis in this study was very poor, and nearly 40% of patients having a visual acuity of 0.1 after treatment. What is the Indian scenario? The Indian scenario, there's a prospective study, last series, 523 eyes, 67% of people who were less than 25 years, of which 80% were male and 20.5% were female. Open globe injury was 20.5% of the cases. And 17.4% of intraocular foreign body cases were there, 11.3% were retinal detachment, and firework injury was 38.5%, which shows that people who are working in different areas, some kind of industry or some kind of doing a job, some carpenter is there, or somebody is a mason, or somebody is a plumber, so they are exposed to more risk of these ocular injuries. If there is a study of ocular trauma in urban population, and this shows that the prevalence of ocular trauma is 2.5%, and if we see the annual incidence is 1.6%, which means 980 per 100,000, and cumulative lifetime prevalence is greater in 40 years, is around 4.3%. So the visual impairment, visual acuity less than 20 by 40 is 8.5 per 1,000 persons, and blinding ocular trauma is 7.3 per 1,000 population. 7.3 per 1,000 population is a big number, and we can't afford to do this. So with this, introduction, I just want to tell you that why this ocular trauma is important for us, not only in India, but is a global, challenge for the health planners and the health policy makers. And thank you very much for giving this.